And we've got PD-1 inhibitors, we've got CTLA-4 inhibitors. Why combine them? What's the benefits of putting them into a single construct other than the obvious one of having just a single drug to give?
Thank you, John. Well, I think that this is relevant to the entire class of drugs. So when you target PD-1 and CTLA-4, they hit different stages of the immune response. That's a complementary biology. So
Yeah.
that's the why for the targets. We know that this dual blockade is effective based off of Checkmate 743 in mesothelioma. But a bispecific antibody really is trying to deliver synergistic effects. So it's potentially a more coordinated engagement. You may have a better therapeutic index than two separate drugs. And so the hope is that we're going to have a more durable benefit, especially in these hard to treat subgroups.
Yeah. Yeah, I've been intrigued about this possibility that you may really get tumor concentration of the drug as well. If one of them is binding in the tumor microenvironment, then you might get that effect. Yeah, do you want to talk about how important you think that is as a way to reduce the toxicity for normal tissue potentially?
Yeah, absolutely. I think the construct of the bispecifics, we know that you can change receptor engagement dynamics. The distribution in the tissue can be different. And focusing exactly that immune activation against the tumor, I think can indicate that these class of drugs will be extremely effective in the future. Varostamig, for example, it
Yeah,
has a really distinct mechanistic design, and it shows that it can have activity even in PD-L1 low negative non-small cell lung cancer
right.
patients, typically cold tumors. And so this has been a major issue in lung with our immunotherapies. And so I think that the structure is going of these bispecific antibodies can have an improved function. And this is the premise behind these engineered agents.